Okay, how and the COVID-19 emergency impacts Americans. So let me see. At the height of the pandemic, a mosque in the South and a hospital in Oceanside, New York, has more than 400 COVID-19 patients, many of whom were very sick. These days, the number is less than five, with no patient in the sensitive care unit, according to the Dr. Glad. The hospital's epidemiologist, I'm on that word. So those numbers are why God associated with the federal government's decision to end the COVID public health emergency. But he also want the public to understand what that means. People have to realize that the benefits that come along with it being a public health emergency will go away. And some of the free things that were given out by the government without concern about the financial reimbursement are going to stop. I have to check this one as well. Let me see. So Google further is reimbursement. Yeah, financial reimbursement are going to stop. That's number one, said Gadet, who also serves as chair of hospital's Department of Medicine and the chief in infectious diseases. Number two is that allowing an emergency situation to occur freed some of the regulatory restrictions that normally would be resent, and those will now go back into play, he says. After more than 3 years, more than 1 million US deaths, and 104.5 million documented infections, the COVID-19 public health emergency comes to an end on May 11. I think the biggest indication of it is symbolic, says Jen Case, and a senior vice president at the Kaiser Family Foundation, a nonprofit that focuses on healthcare research. It really is a marker saying we have in this important declaration that has come to an end, and it's symbolizing a move from this emergency state that allowed for a lot of the flexibility to a different place. The pandemic reached its peak between July 2020 to July 2021. The highest hospitalization rates were recorded in November 2020 and January 2021. What's changing? Americans will feel the end of the COVID-19 emergency in different ways. The age of the free COVID test is over, says Boris Lasniak, the former acting U.S. Surgeon General 2013 to 2014, who now leads the University of the Maryland School of the Public Health. Things that people will notice for the most part is going to be that something that was taken for granted for the last 2.5 years in the midst of this pandemic. We that we kind of got used to is now going to become more complicated. During the pandemic, the federal government mailed mailed more than 700 free COVID tests to the people's homes. Going forward, at-home COVID-19 tests could become more expensive, according to the Kaiser Family Foundation. And people with the private insurance and the traditional Medicare, we no longer to be guaranteed to get them for free. Although private insurers might elect to cover the cost of testing, more than 18% of U.S. population, almost 280 million people, has had at least one shot of the COVID-19 vaccine. The vaccines will continue to be free until the stockpiles purchased by the federal government run out, which experts say will probably be by the end of the year. After that, vaccines will continue to be free for most people with public and private insurance. Medications used to treat COVID-19 also will be free for as long as the federal government supply lasts, which is probably until the fall, and according to Kate. Congress had not authorized the funding needed for the federal government to continue to purchase more vaccines and treatments. Private insurance companies were never required to waive costs for the COVID-19 treatment. For the uninsured or underinsured, the Biden administration has announced a $1 billion program that will continue to give the people with insurance access to COVID-19 care at their local pharmacies. Through existing public health infrastructure and at the local health facilities, still need to be vigilant. I didn't know this word. Let me check it out. How to say it? Vigilant. Vigilant. Okay, vigilant. Vigilant means keeping careful watch for the possible dangers or difficulties. Okay, got it. This is this one. Okay, keep going. Um, Vigilant. The ex- the expiring PHA isn't only the COVID-19 related emergency measure currently in effect. The emergency measures The emergency measure that allowed for the use of the COVID-19 vaccines and treatments will continue beyond May 11. People need to be reassured that the fact that the public health emergency status is going away is a positive thing, not a negative thing. It doesn't mean that we are ignoring this problem. That is done with, Class A says, the tremendous amount of public health work will still go on, and in general, the American public is going to be well taken care of going forward regarding COVID. Although the Lusniak agree that the PHE should be rescinded. He worries the public will assume that the COVID-19 is a thing of the past, even though the COVID-19 remained the fourth leading cause of death in the United States in 2022, behind heart disease, cancer, and unintentional injury. Currently, 150 people in the US die from the coronavirus disease each day. Really, this reality is it's still not over, and we still need to be vigilant, 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 to be vigilant. Luzniak says. If you are not feeling well, stay away from the large crowds. This whole idea of disease spread still remains out there, and there are people who are in the higher risk around us, and so let's be caring towards others. The end of the PSE means that states will no longer be required to report COVID-19 infection to the federal authorities. However, the Centers of Disease Control and Prevention usually has individual agreements with each state regarding reporting incidences of infectious diseases, and all hospitals are required to report COVID-19 admissions through April 2024. Other methods the CDC will use to track future infections include monitoring COVID-19 hospital emergency room visits and by testing the wastewater for evidence of the virus can cause COVID-19. It's not like everything is going to go by the wayside, losing access, but certainly the data will be less vibrant. Oh, it's not easy, huh?